We're here today to look at the exercises you can do before and after a total hip replacement. These exercises are designed to strengthen the muscles round about the joint to help support the joint and to regain the movement in the joint after your operation. So we're going to look at these exercises, Graham. The first exercise we're going to look at...
Do they hurt doing these exercises?
So after you've had an operation, you've had a major operation, then that exercises will hurt a bit. But it's really important from our point of view that you're having your pain relief in the ward setting, and also when you go home you're taking your pain relief regularly, so you can do these exercises on a regular basis.
But if I'm sore and I'm doing these, can you give me something if I'm sore?
We can talk to the nursing staff and they can look at your pain relief, and if you need some extra pain relief before you do your exercises, that's absolutely fine. We can do that for you.
Yeah, but if I'm telling you I'm sore and I need to stop, are folk going to listen to me?
Yeah, of course we are. Yeah, absolutely. We're here to push you as much as we can as physiotherapists, and to push your range of movement and to push the strength. But we don't want you being too sore. So if you're too sore, you need to let us know, and then we can have a look at that.
All right.
Okay. So the first exercise we're going to do, we're going to look at the ankles. So we're just going to pull the ankles towards you and then push them away. Excellent. And we're just doing that repeatedly. And that's just designed to get the muscle pump working, because when you're not as mobile on your feet, the muscles aren't doing as much as they normally would when you're up and about. Good, lovely, and relax, good. Okay, so the next exercise, we're looking at the strength of this muscle here at the front of the thigh. This is the quadricep muscle. So we're looking at pushing down, so you squash down onto my hand, excellent. And as you can see, your heels come up off the bed a little bit, and it's excellent, and relax. Again, we're going to push down, good, and relax. So you're pushing down, holding for about 5 seconds, and then relaxing.
2, 3, 4, 5.
Good.
All right.
And for the purposes of these videos, we're going to do 2 or 3 of each exercise, but when you're doing them at home, you'll be aiming for 10 repetitions of each exercise. Okay, the next exercise, we're going to think about the muscles in your buttocks, okay? So we're going to think about squeezing your buttocks together. Lovely. Good. And relax.
That's a bit sore.
So that one can be a bit sore, because that's sometimes the muscles that have been cut through when they've done the operation. But it is really important that we get these muscles activating again after the operation and then strengthening them up. Okay, so again, squeeze, good, and relax. So again, we're aiming for a 5-second hold when you're doing that one. So one more.
When I'm doing this, my legs are tightening as well. Is that normal?
Yeah, that's normal. Yeah, it's important that we get all these muscles working together. Good. Okay, so the next exercise we're going to look at is looking at getting a bit of movement back into your hip. So we're going to look at bending the hip up. So you're bending the hip and knee, pulling the heel towards your bottom, good, and then letting it back out. Excellent. Good, and again, slide it up.
Foot's kind of sticking.
Okay, good, so I'll back down. Okay, so what you can do at home or in hospital is use a plastic bag. And what that does is just reduces the friction and makes it a little bit easier, okay? So if you use that now, slide up, excellent, and push away. Good.
Oh, that's better.
Now, it's really important when you do this exercise to keep the toes pointing towards the ceiling, okay?
That's a bit harder.
That's okay though, that means we're getting the muscles working properly. It's really important that we do that rather than letting the muscles be a bit lazy at the side there.
Okay.
Good. One more, and push away. Good, okay. The next exercise, we're looking at a different movement. We're looking at the muscles at the side of the hip here. So what you're going to do here is let this leg, keep it nice and straight, and you're sliding it out to the side. So we're sliding out, lovely, and pull it back in. Good. And again, it's important that we keep the toes pointing towards the ceiling to engage all those smaller muscles round about the hip.
So I can't, that's easier.
Yeah, that's easier, but we don't want that. We want to keep it nice and straight towards the ceiling, okay? This is sometimes the most difficult exercise because these are the muscles that have been cut through at the side. So it is really important that you push yourself in this exercise. Sometimes you don't get that much movement when you start this exercise after your operation, but it will get easier and easier with the days go on.
So how far am I trying to go with this?
So you're taking it as far as you're able to, again within your kind of pain limits. We don't want to be causing too much pain.
I could get it off the bed if you wanted.
So we don't want to take it off the bed. We want to keep it nice and supported because that puts different forces through the hip that we're not really looking for right now.
So if I'm at home and I just go across to one side of the bed to give me more.
Absolutely.
Right, okay.
Good.
Actually, I'm on a hospital bed at the moment. Do I need something like this at home?
No, not at all. You can do these exercises either on the bed, your normal bed at home, or you can do them on the floor if you're able to get on and off the floor nice and easily. Okay.
Okay.
Good. So, in summary, the exercises that we've got for the hip on the bed, we're looking at your ankles back and forward. Good. We're looking at the knee, pushing it down, getting the quadricep muscle working. And relax. We're looking at the muscles in your buttocks, squeezing them together. Good. And we're looking at bending up, back down, and we're looking at out to the side. And pull in. Good. Happy with them?
Aye. So how often am I doing these?
So you'd aim to do them 4 times a day, and keep that going until you feel that you don't need to do them anymore, which is usually about 6 weeks.